The recommendation to close operating rooms from 5 days a week to 3 days a week has significant impacts on our ability to provide after-hours care. Perhaps most importantly, by eliminating the days that the OR is open, it eliminates our ability to expand our surgical program to include any new obstetricians and gynecologists that may join our community. This is essential if we're going to preserve our obstetrical program. The other issue is that if we're not providing work for the nurses, for the anesthetists, and for the surgeons during the day, it's quite possible that we may not be able to retain staff in order to provide on-call services. Providing on-call services is essential if we are going to have a functioning obstetrics program, as babies are born any time of day, 7 days a week, and you never know when an emergency happens when you need surgical delivery or cesarean section. It also means that if we're not working and don't have nurses scheduled to be on call, that we can't deal with any of the other illnesses that come in through the emergency department: appendicitis, gallbladder disease, dead bowel, bowel obstructions. Those are all things that we need to have an operating room available to us, even if it's not right away, but we need to have that ability to take a patient to the operating room on an urgent basis should it be required. If our operating room is not open or available 24 hours a day, 7 days a week, we can no longer provide safe care for those patients. And providing surgical care at this hospital is going to be very difficult to maintain. Not providing enough hours during the week means the nursing staff will likely seek work elsewhere. Retaining current staff will be difficult. Recruiting new staff will be difficult. Without adequate staff, we simply can't run a safe surgical program. And my concern is that by further cutting the surgical program electively, we're effectively reducing our ability to provide essential surgical services that happen outside of normal working hours.